Hello and welcome. Let's talk about laxatives. So, what are the synonyms for laxatives? Aperients, purgative, cathartic. The laxatives are the agents that promote evacuation of bowel. Classification: bulk forming laxative, which includes natural plant products like psyllium, methyl cellulose, spagula, or synthetic fibers like polycarbophyll. Or osmotic laxative, which are the most commonly used, like non-absorbable sugar and salts like milk of magnesia, sorbitol, lactulose, magnesium citrate, and sodium phosphate. Or balanced polyethylene glycol like isotonic solution containing an inert and non-absorbable osmotically active sugar with sodium sulfate, sodium chloride, and others. Stool sulfated agents like docusate, glycerin suppository, and mineral oil. Or stimulant laxatives like aloe, senna, cascara, bisocordyl, and sodium picosulfate. Or serotonin receptor agonists like tegaserod. Now, bulk forming laxatives. The mechanism of action is that the laxatives are indigestible hydrophilic colloids that absorb water and form bulky emollient gel and act by increasing volume which distends colon and promotes peristalsis. Adverse effects includes increased bloating and flutters due to bacterial digestion of plant fibers within the colon. Mechanism of action of osmotic laxatives. Osmotic laxatives are soluble but non-absorbable and retain water in the intestine by osmotic force and causes distension and increases stool liquidity, where the increase in the bulk and decrease in the viscosity of the intestinal contents is seen, and indirectly increases the peristalsis and promotes evacuation. Clinical uses includes balanced polyethylene glycol, which is used for the complete colonic cleansing prior to gastrointestinal endoscopic procedures and treatment or prevention of the chronic constipation. Sorbitol or lactulose is used for the treatment or prevention of the chronic constipation, and magnesium citrate and sodium phosphate is used as purgative for rapid relief of constipation within 1 to 3 hours. Adverse effects includes abdominal cramps or flutters, intravascular fluid depletion, and electrolyte imbalance. Contraindication includes for elderly, patients with renal insufficiency, and significant cardiac disease. Now, stimulant or irritant laxatives. The mechanism of action is that these act mainly by increasing water and electrolyte secretion by the mucosa and also by increasing peristalsis by poorly understood mechanism like direct stimulation of enteric nervous system and electrolyte and fluid secretion. Clinical use includes for long-term use in chronic constipation, neurologically impaired and bed-bound patients in long-term care facilities. Adverse effects includes colonic atony and colonic dilatation. Now, stool softeners. The mechanism of action is that these are the surface active agents that permit water and lipid to penetrate and soften stool material. Clinical uses includes to prevent constipation and minimize straining, are used to prevent and treat fecal impaction in young children and debilitated patients. The adverse effects includes severe lipid pneumonitis, impaired absorption of the fat-soluble vitamins due to long-term use of the mineral oil. Misuse of laxatives for dependence, fluid and electrolyte imbalance leading to hypokalemia, steatorrhea, spastic colon, protein losing enteropathy, and rupture of inflamed appendix. End of the topic.